Good evening, everyone, and thanks for joining us for tonight's meeting. It's the GP Masterclass about AI scribes and beyond, and it's a practical introduction for GPs. To begin with, I'd like to acknowledge that the session's being presented in partnership with Avant, and I want to thank Karen Castle and Greg Forrest from Avant for joining us tonight. I'd also like to acknowledge the traditional custodians of the country across Western and Far West New South Wales and their deep and enduring connection with the land, water, culture, and community. I pay my respect to elders past, present, and future and extend that respect and a warm welcome to all Aboriginal people who are joining us this evening. And welcome, everybody. Just a few points. If you're comfortable, why not turn on your camera so that Karen, who's the presenter, can see who's joining us tonight. Stay on mute unless you're asking a question. Karen's very happy to take questions throughout the evening, so you have that option to unmute, ask a question, or you can put your questions in the chat box, or you can wait towards the end of the presentation for the Q&A session. This session's being recorded. There'll be a short evaluation for you to fill out at the end, and Karen's slides will be emailed to you tomorrow. So right now, I'd like to invite Greg Forrest from Avant to introduce Karen, who's our guest speaker tonight. Thanks. Thanks very much, Greg.
You're welcome. I'm speaking very briefly, just to give you a bit of background about Karen. She assists members by providing risk assessment, member risk education, risk management, and prevention strategies. She's got over 20 years in the health industry, predominantly in emergency critical care environment. She's worked in the medical assistance and retrieval industry, where she coordinates services of numerous emergency patients requiring intensive treatment overseas in Australia. Part of a risk advisor's role is exactly this, providing education. And I'm really pleased because we've been looking to partner with the PHN for quite some time. It might be something that we continue to do. And look, if there's a real intake and there's benefit, there's potential, in the year to come to come out and do an in-person visit potentially. So that's my role as a BDM, business development manager at Avant. If there's questions, I'll be sending through some correspondence off the back, education material off the back of Karen's talk. Personally, I'd like to thank Karen for making herself available. I put the request in specifically for Karen to talk tonight. So I am very positive that you're going to get some practical takes out of tonight. Just before I go, it's coming up to 30th of June. So I assist doctors in your practice with their indemnity insurance. Also, the last thing that Karen does, part of the role that she does in addition to this, is that if you have an Avant practice insurance policy, you can get an individual assessment, a risk assessment as part of a practice policy. If you have a practice policy, let me know about that. I'll be sending my details through to the PHN. If you don't know what it is, also let me know about that, because I'm happy to have conversations with you outside of this. But I'm going to leave it there and say, look, thanks so much, Karen.
Great. And thank you, everybody, for inviting me to speak tonight. I do just want to acknowledge the land that I'm situated on tonight, and that is on the Gadigal land. And I'm from northern New South Wales, which is Yagal country. And I'd also like to acknowledge the Bundjalung people that are up that way. I'm just going to share my screen. Hopefully this works, because you never know when it comes to IT. And hopefully we're doing okay there. Yes, thumbs up. All right. Now, I will be in presenter mode for a little while here. So please, and I really love to have interaction during my talks, because otherwise it can get a little bit dry. So just call out, involve yourself. I'm not precious, so I don't mind being challenged. I think it's great, it's healthy. So please keep yourself, the finger on the pulse being the mute button or the unmute. All right, so let's get started. So tonight we're going to talk about a very topical subject, AI scribes, and beyond. So I will really focus on AI scribes, mostly because that's what we're seeing, in general practice at the moment. But I do want to touch on some new tools that are coming out, which is very, very exciting. So tonight we'll talk about how AI scribes work in your everyday practice. We'll identify some key risks and compliance considerations when you're using AI for clinical documentation. And I'd like to give some practical steps on how you can safely implement those AI scribes in your practice. And we'll just touch, like I said, we'll just touch on some of the new emerging AI tools that are relevant to general practice. So I like to start with this slide because this is me dabbling in a little bit of ChatGPT when I was coming up with a bit of a fun slide about where AI in healthcare is going. And on first glance, it looks quite good. It's quite convincing. But if you delve a little bit closer, it's got some spelling mistakes. It's got some duplications. It's, things are a little bit off. And that's kind of where we want to talk about tonight, where, some things are really, really great on the surface, but not always the case. So we'll talk about that. So this sort of gives you a bit of a snapshot around the types of AI tools that are already making way into general practice. So starting on the conveyor belt there, you can see that we've got the AI scribe, and that's capturing or summarizing our consults in real time. And then we have the digital assistants, which are starting to handle administrative tasks and even some basic patient interactions. There's triage tools that are helping patients assess their symptoms or even skin lesions before they walk in the door to see you. We're seeing some clinical decision support tools popping up in our software, and this is where it's really, really changing in general practice. And they're offering differential diagnosis or flagging drug interactions, and they might even be highlighting to you some missed care opportunities. We're seeing some predictive analytics that are starting to guide chronic disease management, and some practice are already using wearables or remote monitoring to track patient data, which is pretty exciting. And in pathology and imaging, AI is now reviewing X-rays, mammograms, histopathology slides, flagging anything that needs a bit of a closer look. And the translation tools are making communication easier for our patients from non-English speaking backgrounds. So the pace of innovation isn't slowing down, it's actually speeding up. So hold on to your keyboards, people, because AI is evolving faster than Medicare rebate changes, that is for sure. Now, the real question is how we can decide what is useful, what is safe, and how we can integrate this into your workflow in a way that it actually helps, and it helps your patients as well. So who in the audience is using AI scribes at the moment? Do you want to call out or put your hand up? A few of you? Yep, that's great. Well, we actually did a survey back in 2024, and it actually only showed that at that time, 11% of our members, so Avant is the largest insurer of doctors in Australia, and so we had about 600 people only, but still a pretty good survey, and only about 11% of people were using AI scribes at that time. Now, fast forward a few months to February 2025, and 19% were using it. And if you've read the recent articles from RACGP, they state that 2 in 5 GPs are now using AI. But we anecdotally at Avant are already seeing about, across the board for our members, about 50% of our members using AI in some form, which is pretty amazing in a very, very short amount of time. So it's not a matter of if you'll use it, it's a matter of when you'll use it. So what are the benefits of using an AI scribe? And I'm going to focus a little bit about AI scribes. So if you do have other questions, just feel free to jump in. So the potential benefits of using an AI scribe in our practice, and this is what we've heard from our members and from our patients, is that there's this improved communication between the doctor and the patient. And it's because you're not sitting there looking at your keyboard, typing away, turning away from your patient. You're actually having to verbalize everything that you're doing. You're not having to look at your screen and type. You're just actually interacting face to face. And so the patients are loving that. They're loving it because you're actually talking to them face to face, looking at them, making that eye contact, but also because you're verbalizing everything that you have to say. Because an AI scribe listens, and if you don't verbalize everything that you're doing or everything that you're thinking, it's not going to be in your medical records. So these ambient AI scribes will listen, you'll be verbalizing, the patient's listening, they feel more informed. It's a much better patient experience. It's also providing a more detailed medical record, which is great for us at Avant because it helps us then to defend you, because often we will hear from our doctors saying, but I did say that, or I did do that, but it's actually not written down. But if you're using an AI scribe and you're verbalizing everything that you're doing, then it will capture that in your medical record. So that's really helpful. And actually, we've seen the medical council who have performed medical audits on some of our doctors, and they've seen a vast improvement who have not been using an AI scribe and who are now using an AI scribe. So they're pretty pleased with that too. There's an increase in prevention or early prevention because of the prompts that are captured. There's a big time-saving factor. The number of doctors that I've spoken to have said, I can now go home at 5, 6 o'clock at night and not be spending extra hours having to catch up on all my medical records because they're done at the time. So they're actually getting more time with their family. It doesn't mean that you get to see more patients or, that the practice manager gets to slot more people in at the end of the day, but it's really good for your work-life balance. And we're starting to see that there's real improved decision making because it's aided by that accurate, detailed, and up-to-date clinical notes, meaning that when your colleague comes to take over from you, when you're on a day off or what have you, or on leave, your colleague can go, oh, I can actually see exactly what happened. Now, the risk here, and what some of our members have said, is that yes, it produces this beautiful, lovely medical record, but it's really, really, really long. And it takes us 10 minutes to read that medical record. So that's something that you have to think about, whether it's, a positive or a negative, or that you tweak the way that you use the tool. So then you have a more concise record, something to think about. And there's also this reduced risk of transcription errors by creating multiple documents from the same source of data. So meaning that you've got the AI scribe that's listening to your consultation, you can create a referral letter to another specialist, you can create a treatment plan, you can create chronic condition management plans, you can create safety netting, so patient information sheets, all sorts of things just from that one consultation. You don't have to do all of this extra work. It will do it for you. So it's pretty exciting. What are some of the risks though? And this is what we want to talk a little bit about today. So it can be really fantastic, but if we use it carelessly, we lose something far more valuable than efficiency, and that is our patients' trust. So let's spend the next few minutes looking at some of the risks, what can go wrong, and what we need to do to keep our patients safe and confident in our care. Now, just before I skip on, does anyone have any questions or want to talk about their experience that they've had with AI scribes to date? No? Another couple of things that I think is probably worth raising is, we talked about the really good things back there, but also, but some of the other risks are the notes might be too long, takes a bit extra time to read those notes. And some other things is some doctors will say, oh, I like to actually type my notes or write my notes because it helps me think about what the plan is, and not actually having that ability to do that then takes away that thought process sometimes. But you can get around that. You can still jot down notes. You can still type in things. That's absolutely okay. All right. So these are some of the things that we'll talk about tonight. Your professional obligations, doing your due diligence and governance, looking at your product terms and conditions, quality and safety, privacy, consent, and accuracy. There's a wonderful checklist if you're thinking about implementing an AI scribe at your practice, and this will be part of your resource pack. So ethics and trust sit at the core of healthcare, right? Patients place their trust in you because they believe your decisions are made in their best interest. Now, from our perspective at Avant, trust is critical because when patients are informed upfront, they are less likely to feel misled or to make a complaint if something goes wrong because they understood the risks from the outset. We all know this, right? And if something does go wrong, your actions will be assessed by your peers against the standards set out in the Code of Conduct. Now, if you haven't read the Medical Board of Australia's Code of Conduct, I urge you to do so. It's part of your registration, you must do. But it applies to every decision that you make, whether or not AI is involved. Now, regardless of the technology that is used, the doctor remains responsible for delivering safe, high quality care and for ensuring that their practice meets the professional obligations outlined in the code. Now, AI doesn't change your ethical responsibilities. So looking at the code, there are a few key obligations that are particularly relevant when using AI. So firstly, providing good care. So your clinical decisions still need to be based on the best available information. You can't rely on AI outputs without applying your own clinical judgment. Then there's informed consent and shared decision making. Patients should understand how their care is being delivered, including when AI is being used to support decision making or documentation. And that then leads on again to maintaining trust because it is central. Patients need to feel confident that their information is handled appropriately and that their care is unbiased and that you, not the technology, is responsible for their care. And people are very, very worried these days about who has access to their information, particularly, and some people will get a bit scared about AI. So that's why it's important to involve them in this. And finally, there's professional accountability. So if the AI tool generates an error and it's not identified at the time, and that information makes its way into the patient record, you still remain accountable for that outcome. So think of the code as your ethical compass. If you use an AI and it can't be explained in a way that aligns to these principles, then you shouldn't be using it. So whilst we want to support innovation, it's really important that we do. Before bringing any AI tool into your practice, especially because a lot of these AI tools aren't regulated yet, it's important that you step back and do your own due diligence. So I want you to first consider what is the basis for using the tool? And is it going to be a benefit to you and to your patients? So if it's actually going to take you more time to read through those notes, or it's going to take you more time to read it and learn the tool or what have you, when you've already got pretty good notes, it might not be a benefit to you. Something to think about. Next, you should not ever rush into just implementing a tool. And because there's so many tools out there now, and you have these wonderful salespeople who try to push and say how fancy it is, you really need to do your due diligence and before you implement that tool that you might not understand. So the first thing you need to do is ask if it's safe and is it validated. So would a reasonable doctor in your position trust that tool? And can you explain the tool to your patient? And if you can't explain it, then you shouldn't use it. And this is because not only because you need to understand the product that you're using, but because the patient needs to have informed consent. Okay. And would you make the same decision without that tool? And if the answer is no, then you need to stop and reconsider. So if you can't confidently say yes to all of those three, then it would be very difficult to justify your decision if there was a complaint or a claim that arises from using an AI tool. Now, I just want to stop there. Is there any questions? Okay. So this is one that everyone gets a little bit uncomfortable about. It's the terms and conditions. Now, it's something that you need to be cautious if the service agreement for that scribing tool that you intend to use has an indemnity clause which shifts all the responsibility of the failures onto the user, meaning you. So broad indemnity clauses which seek to absolve the developers of liability is a big issue. So you need to be looking at those contracts that contain clauses that might redirect that liability from them to you. If you're ever unsure, then you can always reach out to your MDO to have a look. That's what we're here for. We can always look at that. But certainly at Avant, we don't cover product liability or a liability assumed under the contract. And this situation can then sometimes leave doctors exposed to that legal liability and patients potentially unable to obtain redress in the cause of harm. So you really need to, as practices, if there's any practice managers online or doctors, before you sign up to that service agreement, you need to read it carefully and make sure that it doesn't contain one of these clauses. And if it does, get advice from either us if we're your MDO or your other MDO. Now, the use of AI scribes, like I said before, is largely unregulated, or there is very limited governance in this area at the moment. However, the Australian National Artificial Intelligence Centre has developed voluntary standards or guardrails to assist you with navigating the space safely. And adopting these guardrails will create a foundation for safe and responsible AI use. It will make it easier for you to comply with any potential future regulatory requirements in Australia. Now, AI tools are only as good as the data that they were trained on, and many use overseas or non-representative data. So it's important that you review the tool's performance regularly. So if you're using a virtual assistant, for example, so a virtual assistant might be someone who, when a patient calls to make an appointment, the AI assistant will answer the phone and they will create the appointment, for example. And so testing that or checking that performance would be, how often is the call dropped? How often does the patient who's calling, how often do they opt to speak to a human because they don't want to speak to the AI? Or how often is that appointment time set up incorrectly? Just like you would checking compliance with your front desk staff, you'd be checking your AI tool as well. You need to also check before you implement any sort of AI tool that you have access to historical data for audits or complaints. So, and this is really a process that allows you to challenge the AI outcome. So with AI scribes, you tend to keep the transcription. So when it's listening to the consultation, it's listening and it's recording word for word. That's what we call the transcription. And most practices will keep, or doctors will keep that for about 7 days. So give them a bit of an opportunity to check the medical record and to make sure there's no errors, or if something else was to happen, for example, if the software goes down or the backup fails or something, then they've got something. There's that little bit of lag there. You do need to make sure that you update your privacy and cybersecurity policies. And you need to review that your existing cybersecurity practices are sufficient to address the risks arising from the AI system use. So that's a really, really important one. So if you haven't got an IT specialist that's looking after your cybersecurity at your practice, then you need to get one. The amount of times that I've heard doctors say to me, or practice managers say, well, I have a really big interest in IT. And I'll say, oh, well, that's great. So tell me about the Essential 8. And they say, oh, I don't know what that is. And I go, well, you're just not up to running a practice's IT. So it's really important that you do outsource that. It's too sophisticated these days. The National Artificial Intelligence Centre recommend completing a risk assessment initially. And before you all groan at me, your practice managers are probably doing this already informally, and some are probably formally. And this is essentially just looking at identifying what risk could occur when you're implementing this new tool, and putting in some controls on how to mitigate that risk. So for example, if the power went down, if there was a blackout and you lost all of your notes, for example, what would you do? Or making sure that there's a risk of inaccurate medical records. So the control would be that the doctor must review their notes straight away, for example. The other thing is that, and I just do want to just touch on this again, that you do need to regularly review that tool's performance, because we often see that the practices will implement it. Everyone's like very excited. They'll be checking it all the time. Everyone's very alert to any errors, but then 3, 6, 12 months down the track, they've just become complacent. And we know complacency is the enemy. So you do need to still reassess whether that tool is being accurate, because it does hallucinate, and that is fit for purpose, and it's still giving you value. And then on that point, you do need then to appoint a responsible person to monitor the AI use, and to be putting that risk register or the risk assessment together, and setting setting reminders, so then they're across the regulatory space. So if there are any legislation changes or any regulatory requirements that relate to AI in the practice, such as in case the day that the TGA says, yes, we're going to regulate all AI scribes, are you using a regulated scribe, or do you need to then switch, for example? And it's important to try.
I wonder
Yep.
if I could ask a question
Yes, of
here.
course.
So with respect to regularly reviewing the tool's performance, is what you mean by that you're always checking your notes, and you've got an idea of what the frequency of mistakes, or whether there's mistakes of greater significance. So is that what you mean? It's the reviewing of notes and checking performance that way.
Yeah, when it comes to AI scribes, that's exactly it. And then once the AI scribes develop more, and certainly Heidi's already doing this, it's already putting in differentials and pulling up sources from all sorts of other places, like Up to Date or therapeutic guidelines and all these things. And you want to be making sure that it's not throwing things into your notes that are completely inaccurate.
So
I will give you some examples. Sorry, go ahead.
I was just going to say, in addition to being a scribe, it's also being a diagnostic aid. Is that correct?
Yeah,
So
yes, and we have to be careful about that, because as soon as you start saying that it diagnoses, provides a diagnosis, or has a decision-making element, then that's a TGA regulated tool. So that's why they're sort of walking a very fine line. They're just, it's reviewing your notes and saying, oh, have you thought about looking at the guidelines to kidney health and or have you thought about putting this person on a chronic condition management plan? Or here's an article on the best practice of treating elbow tendonitis, for example. Lots of different things. So it's a very interesting space, and what I'm saying today will be more than likely outdated in 6 months, because we're already seeing that.
Yeah. And one last question. I think the scenarios that you've been referring to sound like practice-wise wide decisions are made regarding use of AI scribes and which one. Is there any downside to individual practitioners within a practice choosing which scribe they would use preferentially and basically going into a contract as individuals with the...
Great question. And this is where we're seeing, we might see a practice that says, absolutely no, we're not going to use AI, can't do it. But as we know, our practices can't tell our independent practitioners what to do. So as a practice, you'd be best to say, yes, we acknowledge that people want to use AI for their notes. It saves time, it's helpful, patient really finds it valuable. So we're going to create a policy now to say, yes, we acknowledge that you're going to do this, but we really just want you to use medical AI scribes. So those fit for purpose ones, not open AI. And that would be where it would be very prescriptive in your policy. And remember, as a practice, you create the rules, the policies and procedures that everyone has to abide by, and regardless if you're an independent practitioner. So so that's where my suggestion would be. And I guess because there's 50 plus AI scribes, probably more than that now. So it's just a matter of making sure that it, and which I'll talk about in a second, some of the things that you need to think about before you say yes to a scribe. And let me just skip on to that, shall I? Privacy and security, the big one. So the privacy legislation now requires you to inform your patients about how you deal with their personal information, including how you collect and use their information within the practice and who you disclose the information to. We all do this. This is part of your practice, your practice privacy policy. So this is not unique to that. So the company that provides the AI tool is a third party that is outside of your practice. So therefore, you have to update your privacy policy to include your AI scribe as a third party who you're disclosing patient information to. Now, it's really important when we're talking about looking at scribes to investigate the tool's privacy functions and to find out, first of all, what protections are in place to protect the information. So not just the tool, but also in your practice. When I talked about the cybersecurity, you want to make sure that this information can't be intercepted, because you're holding this very, very valuable information. That's the patient's health information. So the next thing is that you want to make sure that it's compliant to the Australian privacy laws, so to the Privacy Act or the Australian privacy principles. If they don't do that, then I'd be saying maybe have a look at some other options. So if they're sending information overseas, if their servers are stored overseas, that has to be specifically disclosed to your patient before using the tool. Okay, you need explicit consent from your patient. So there's a lot of scribes in Australia now that are compliant to the Australian privacy principles or the Australian Privacy Act. So I would urge you then to probably use those rather than the overseas. You need to find out how long the data is being kept for. So how long is the tool keeping those records, the transcription? Is it encrypted? Can you access it? Like I said, some practices will have a 7-day period that they can still access that transcription. But you want to be making sure that you're not keeping it longer than that, for example, because it's all recoverable then. For example, if you had a subpoena, and transcription can be grossly inaccurate. You need to understand whether or not the AI tool is a closed system or an open system. So for example, ChatGPT is open AI. Okay, so it goes out to the big wide world web. Anyone has access to that. A closed system is like Lyrebird or Heidi, or even, for example, Copilot. If you subscribed to a business Copilot, it can be closed, a closed environment, so it doesn't go out to the World Wide Web. No one else has access to it. So you just do need to be very, very careful of that and make sure that it is a closed system. And is the tool learning from the information that you're putting into it? So look for that statement that the tool is compliant to the Australian privacy laws, and also think about if there's any physicians on the call that have tools that detect skin cancer, for example. We're starting to see some of those tools that now have hidden AI. So where they didn't, it wasn't turned on, and now it's like they've updated the software and now they've got hidden AI to help detect cancer or to triage those specific skin lesions. And so it's something to be aware of if you're doing that, because you will have to, again, it's a third party accessing your patient's health information, so you'll have to update your privacy policy and let your patients know. And so this is just essentially to build trust, that you need to provide that clear and user-friendly explanations to your patients on how their AI tool work and those safeguards in place to protect the patient data, because patients get very, 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 very worried about their information. We've had, for myself, I had the trifecta. I had the Latitude breach, I had the Medibank breach, and I had the Optus breach, and I'm not the only one. So my information's all the way out there, but people are very nervous these days about who has access to their information. And I didn't talk about this on the last slide, but I do want to just raise it now. Training your staff. So it's very important that your front desk staff know what an AI scribe is if you're using it, because the last thing you want to do is have Mr. Jones come into your consult and go, I don't understand what this AI scribe is. Can you explain it to me? I'm really nervous. And it takes 45 minutes to explain what AI scribe is to them. You've lost your time. So start early, start putting posters up. A lot of these scribes now have QR codes or information sheets for your patients. Tell Marianne at the front desk how it works, so then they can tell your patients. Start that education early, so then you're not stuck with the patient trying to explain it all in great detail. Of course, you need to know that, and you might still get questions, but you want to try to reduce that time burden in your consultation, which then comes on to consent. Now, the fact that the tool listens to the consultation, so these are like a tool that is like listening to everything that happens in the consultation. And the beautiful thing about these AI scribes is that you could be talking about, I sold 3 head of cattle at the markets last week, and I'm a bit worried about the fertilizer situation, or blah blah blah. It cuts out all of that stuff. It only captures the really relevant things in your medical records, which is a fantastic thing. But because it's listening, then you need to get consent from your patient, and not just once when you first start using it with your patient, it's every single time. And I'll explain the reasons why for that. So the first thing is that there's changes to the privacy laws that you must disclose to your patients, or you must get consent, or you must tell your patients how who you're disclosing their information to. So again, that's on your privacy policy. So you must obtain patients' consent relating to the privacy policy or the privacy principles. That's what they say. The OAIC, the Office of the Australian Information Commissioner, which is the Privacy Commissioner. So AI scribing tools are, like I said, essentially introducing a third party into your into the consultation. And you wouldn't have a third party in that consultation with your patient without consent. So it's exactly the same thing. The second thing, which is very, very important, is that if you don't get consent from your patient to use a tool that's listening, then you may trigger the Surveillance Act of New South Wales, which then can lead to criminal implications. So the Surveillance Act of New South Wales says that you cannot record any part of a conversation without the consent of each person within that conversation. And so therefore, if you don't ask for consent, then you might trigger that legislation and then have criminal implications. And further to that, the Australian consumer law prohibits against unfair practices. So, for example, it might trigger the Australian consumer law because it might lead to misleading representation because you haven't disclosed that you're using an AI, for example. So there's a few things there that could be a problem. So that's why you need to be getting consent every time. And the third reason is what I've always said. Trust is the foundation of our relationship with our patients. And if you're not saying, hey, Mrs. Jones, is it okay if I use this AI scribe again? Then you're not being transparent. And we've actually seen a complaint early days where the patient saw the little recording bubble on the screen and made a complaint to the Privacy Commissioner because they said, I think the doctor was recording me, and they were using an AI scribe, but they didn't get consent. They didn't let them know. So it's really, in order to trust these AI tools, patients need to know that the tool is being used and why it's being used for. It's all about being transparent and to build that trust. And eventually, over time, AI will just become an accepted part of clinical practice. Like I said, it's not a matter of if, it's when. And we'll actually see and we're seeing at the moment, patients saying, why are you not using an AI scribe? Dr. Jones up the street, he uses an AI scribe. I mean, it's so great. I love it. I can get these lovely handouts. And so it's going to become part and parcel of our practice. But at the moment, you really do need to get consent every time. Do you need to get written consent every time? No. But like I said, it's a layered approach. So, you're starting off with educating your patients at the front desk. You might have something on your patient registration form saying, we use an AI scribe to help write our notes. Please let us know if you don't want us to use that. For example, you might have your QR codes. You're getting Marianne at the front desk to educate your patients. You're then saying, oh, Mrs. Jones, is it okay if I use that AI scribe again? For example, so you give more explanation initially, and then over time, they might not need as much explanation. A lot of these tools, if you're using already an AI scribe, you know that they prompt you at the beginning to get consent from your patient, and it won't let you proceed until you've ticked the box to get consent. And then it also documents in your notes that you've gained consent. For those tools that don't do that, you do need to write that you've gain consent, and it's from every person that's in that room. So if you've got the nurse in the room, if you've got Mr. Jones and his daughter, you have to get consent from all of those.
Could I ask another question, Karen?
Of course, please.
So I use Lyrebird, and our practice software is Best Practice.
Mm-hmm.
And I've kept Lyrebird separate. So I do a correction and then I copy and paste. I don't know why I'm doing that. Is there any problem with integrating? I, I yeah, I just thought if I kept my patient's um, initial notes separate on Lyrebird and I don't put any identifiers there. So it really, after I've corrected it and cut and pasted, it sort of becomes theirs. Do you have any comments about that?
Yes, I do actually. We found that the integration, so just to explain to people in the audience who don't know what I'm talking about, so you can have a standalone AI that you use in your internet browser, and then you log in that way, and then you'd have to, if you do you run your consultation, and then you have to copy and paste over into Best Practice or Medical Director, whatever software you have, into your notes that way. We've seen lots of errors happen that way for a couple of reasons. The internet goes down, or the doctor has not copied and paste straight away and have quite a few records waiting to copy and paste into medical records, so they get them all mixed up. So then there's inaccurate or incorrect records. And we've seen records lost that way as well, for various reasons. So the semi-integration, so we call it semi-integration because it's not built by Best Practice, for example, so it's not their tool. They have this API, which is like little codes that they can talk to each other. But so kind of like your MIMS and safe script, so you can click on something and it all works together. That's really helpful because it already auto-populates your patient's names and it goes straight into the patient's record. So once you open up Mr. Jack Jones and you get your consent and everything, then you can start and it will automatically go into your medical records. Once you check it and you press save, as you would normally anyway. So it is safer, and that's why they're doing it. Does that answer your question?
Definitely. I'll need to make a change, I think. Thank you.
And most of the AI scribes in Australia now are can be integrated, or what we call semi-integrated, into the medical records software to make it easier for you, because it is safer in that way. And I don't know whether you all know this, but some of you might. Best Practice have now collaborated with Lyrebird and provide Lyrebird free of charge within Best Practice. So this is the sort of, we're seeing this just evolve even more. So it's, like I said, it's not going to be an if, it's going to be a when you adopt it. But one of the biggest risks when it comes to AI scribing tool, and that's accuracy. And as you could imagine, accuracy is critical when you're using any AI in healthcare, whether it's a scribe or a decision support tool or anything else. AI can generate notes or suggestions that look logical, that they might be well written and convincing, but it doesn't mean that they're not correct or complete. And we saw that at the beginning when I had my ChatGPT slide. So AI scribes actually learn from you, and they learn how to create these plausible clinical notes. But it doesn't understand the truth of what it's generating. And they might miss a nuance in the conversation, or it might not actually hear. So it can be dependent on your microphones. It can also be dependent on the way that you speak. If people have accents, sometimes ambient noise. So it all depends. And that's why it's important to trial these before you start using them on your patients. So have a trial with each other, have a trial with your practice manager, your front desk staff, use your test patients in your Best Practice or medical director, that sort of thing, and see what actually is generating. But it's quite interesting. I'll give you some examples in a minute how it can make errors, or what we call hallucinate. It can just completely make things up entirely. But it's important to know, and remember, going back to your code of conduct, that using AI doesn't shift the responsibility of having accurate, good medical records. So regardless of what tool you use, you're still responsible for that safe and quality care, and you must then apply your own clinical judgment to any of the AI output. And if there's an error and you haven't identified it and corrected it immediately, that accountability rests with the doctor. And there is no defense to say, oh, well, the AI did that, or the AI suggested it. And we've seen some cases already with that. And you might already be aware of some of those in the media. And at Avant, we're aware that some AI scribes are now suggesting MBS item numbers. Now, this is an area that you need to be particularly careful, because if you submit a claim with Medicare, you must be satisfied that every requirement of that MBS item number is met. Again, it won't be any defense to say that the AI recommended the item number. So practically, this means that you should be reviewing your AI generated notes during the consultation, or as soon as possible after that consultation, whilst you've still got it fresh in your mind. So it's really, really, really important that you're checking. And I'll give you some more examples in a minute. And for the practice managers, you should be also auditing the medical records regularly as well, checking to see if they're helping your doctors or helping your nurses. Are they operating as you all would intend them to? And is it actually helping your patients as well? You know, if you're working in Aboriginal medical service, for example, is it actually helping? Is it creating equal care? And we've actually seen, and I'll skip on because I want to give you some examples. They're quite good. So we've spoken to a lot of our members who use AI scribes over the last year, and many of them have said that errors were frequent. And I know because I also use an AI scribe, and they're grossly inaccurate if you're reading the transcript, but then when it goes into your medical record, the inconsistencies can be around the names of people, the places, the medications. They sometimes get the left and right mixed up, sometimes the positive and the negative. So for example, we've seen a patient say that they haven't had any seizures, for example, and the AI scribe reported that they didn't have epilepsy. Yes, they still have epilepsy, they just haven't had any recent seizures. A patient was asked if they had any chest pain, even though they said no, it was written yes. And this is actually a real case. And so it generated a referral letter to a cardiologist. The cardiologist reviewed the referral. The referral had said that the patient had chest pain. They triaged that urgently to get that patient in. The patient came in and said, no, I didn't have any chest pain. So that cardiologist just called up the GP and got very, very mad, for example. And very scarily, if that's such a word, there was one case where an AI scribe made up a complete neuro exam just because the doctor asked a couple of questions within a neuro exam. It just completely made up the whole entire exam. And it was, thankfully, the doctor had checked their medical records and was able to stop that. But part of your resource list is a fact sheet that has a lot of these examples listed. Getting medications mixed up, olmesartan instead of irbesartan, for example, pretty big errors. So like I said, it can look very convincing, seem logical, but you need to read the fine print, and sometimes the context can change. So this leads us on to the next key risk, and that's the use of the general purpose AI tools like ChatGPT. Now, these tools are built on large language models that pull information from huge amounts of data from the internet. And we know how much misinformation or fake news that exists online. So while, like I said, the response can look quite polished or convincing, can actually be completely inaccurate. And from a privacy perspective, this is where the risk really escalates, because when you're using these open AI tools, you're agreeing to their terms of use, and you have very little control over what happens to the information that you're entering in there. And that while and that data might be stored permanently somewhere. It might be used to train future systems, for example. Often these servers are located overseas, and so then you don't have those Australian privacy protections, for example. And even if you think, and this is what we often say, well, what happens if I just put in, some information that, it doesn't have the patient's name and what have you? But if you think that you've de-identified that information, re-identification is increasingly easy. Okay, so for example, the ChatGPT 5.0, it remembers you. It remembers all the information that you've entered into it previously, and it can start to piece things together. So it's very important that you're not using ChatGPT for your patient consults or your patient information. On top of that, they're not clinical. They're not a medical scribe. They're not a medical AI. So they don't understand the clinical context or the nuance or the risk. They just rely on probability, not on clinical judgment. Okay, and the OAIC, so the Privacy Commissioner, has published guidance on this, and I'll just read what they state. As a matter of best practice, the OAIC recommends that organisations do not enter personal information and particularly sensitive information into publicly available generated AI tools due to the significance and complex privacy risks involved. So the key message here is simple. Never put patient information into general purpose AI tools, even if you believe that they are de-identified. Always assume that that data that you're putting into ChatGPT is available to everyone else in the World Wide Web. Like you're posting something on social media, everyone has access. So just think of it that way. And for the practice managers on the call, we've heard where people are using ChatGPT or Copilot, OpenAI for their team meetings. It's the same thing. You're talking about patients, you're talking about business IP. You don't want to be doing that onto an OpenAI. We have a really great case study that is published about a GP registrar who wanted to help draft a patient letter and copied parts of the patient's clinical notes into ChatGPT. And it was only discovered that when the doctor had sent the letter to the non-GP specialist with the wrong patient name, that they were using this ChatGPT, and there now was a notifiable data breach to the Privacy Commissioner. I'll put that fact sheet with that case study in our resource list that I'll send you. But what's beyond AI scribes? Well, this is where AI in healthcare is rapidly moving beyond documentation tools, and it's now being applied across the entire healthcare systems, from diagnosis and treatment through to research, operations, and patient engagement. So, for example, in diagnostics, AI is already being used in medical imaging to improve detection rates, with studies showing increased cancer detection when AI supports radiologists. For example, I think it's an 8% increase in accuracy when it comes to mammograms, which is, I would want that. In hospitals, AIs are being used to predict patient deterioration or hospital administration or the length of stay, which is allowing earlier intervention and then more proactive care. In the community, AI-powered chatbots and symptom checkers are also increasingly being used by patients at a first point of contact. If anyone's been onto Health Direct, they use an AI. And so does NIB. So for your symptom checkers, really interesting. And in pharmaceutical and research, AI is accelerating drug discovery, and they're analysing hundreds of thousands of potential molecules in weeks rather than months. So it's a huge movement in healthcare. At a system level, AI is also being used to optimise workflows such as triage, scheduling, patient flow, improving efficiency and reducing administrative burden. We're seeing this in, particularly in GP land, where some AI is able to read all your incoming correspondence and then file them straight into the patient's medical record. So if you're getting a feedback letter from a psychiatrist, it will see that come into your email, and it will file it into your best practice, for example. One of the Queensland PHNs trialled an AI-powered voice technology to contact patients and to support their registration with my Medicare, so sort of get people to sign up for my Medicare. So that was interesting. And like I said, we're also seeing this emergence with a multimodal AI, where a system that combines clinical notes also combines imaging and pathology, and you might have some clinical insights or some clinical decision-making tools, all sorts of things that are suggested at you at the time to help support you in your consultation. So it isn't just about scribes, it's actually being embedded across the entire healthcare ecosystem. But like I said before, privacy and trust remain critical. And the World Health Organization warned that AI adoption in health is outpacing legal safeguards, with only 8% of countries having liability standards. And as we know, and as you've heard me say already tonight, patients want transparency about how their information is being used, and they really want confidence that there is clear governance and an ethical design to these tools. All right. So we've got just a couple more slides, and then I'll let you all go. But you need to prepare for the unexpected. So when you're relying on these AI tools, you need to be able to quickly and safely disengage from the system if there is a problem. So think about the CrowdStrike outage. If that happened again, what would you do if you were relying on AI tools, which is going to be interesting as we see our GP registrars using AI tools all the time and not actually learning how to write a consultation note or going back to pen and paper, for example. What will you do if your patient says, no, I don't want to use the AI scribe? You have to then go back to the old way of writing your notes, for example. Fundamentally, remember that AI scribing tools are just tools. They're just that. They're there to assist you, not to replace you. The doctor will always be responsible for checking the accuracy of the output of the tool. And before you implement any AI tool, make sure that there is a clinical justification in doing so. That is, make sure that there is a benefit to the doctor and to the patient before you implement and use the tool. And when you do implement an AI tool, continue to check that it's functioning in the way it is meant to, because they do tend to evolve themselves and hallucinate over time. So it's not just a set and forget. So in conclusion, like I said, don't rush into untested systems. Don't get wrapped up in the sales spiel. You really want to do your due diligence. Make sure you're getting consent. You don't have to get written consent every time. You just need to get verbal, but document in your notes. Make sure that you do review any of the outputs. Review your records. Make sure that you do that before you save them into your into the patient's file. Like I said, don't set and forget. Do regular auditing of your AI outputs to ensure that it's still safe and appropriate use. And lastly, the tool supports you. It doesn't replace you in your critical thinking. All right, here's a QR code, which essentially is our AI landing page. This will evolve over time because AI is evolving all the time.